In a landmark achievement for pediatric vision care, Nethradhama Super Speciality Eye Hospital in Bengaluru has successfully performed cataract surgery on a 6-week-old infant. Led by world-renowned ophthalmologist Professor Dr. Ganesh, this delicate procedure is one of the youngest of its kind in India. The timely intervention has restored the infant's sight, highlighting the critical importance of early diagnosis and expert care in preventing lifelong visual impairment.
Hello, I am Dr. Ganesh, Chairman and Managing Director of Nethradhama Hospitals Private Limited, and today I want to share a very unique case. This was a 5-week-old baby with congenital cataract in one eye, which was referred to a hospital by another eye surgeon for treatment. The child was diagnosed as a congenital cataract. When the parents recognized that there was something wrong, they saw a white reflex in the eye and then took the child to their eye doctor. And the eye doctor suspected that it may be cataract or some other problem, so he referred to us to manage the case. Now the parents actually were very shocked, and in fact I would say they never expected that a 5-week-old child the newborn child can have congenital cataract. So they were very anxious, very apprehensive as to whether the child will get vision, whether surgery can be done. They had a lot of questions. It took almost an hour and a half to kind of counsel them about the problem, what the problem is, why the problem comes, how it can be treated, what are all the efforts involved, and post-op, what is the care that should be given, what is the duration, what is their role in the treatment. All this was counseled, and after that the child was thoroughly investigated for any other congenital problems, and our anesthesia department did a full pre-anesthetic evaluation, and then we fixed the date for surgery. The surgery itself took about half an hour. Since it is a 6-week-old child, we decided to do the surgery in 2 stages. First stage is removing the cataract. The cataract was very dense and fibrous, so we had to actually remove, because it was completely blocking the light. We had to remove the cataract so that light enters the eye and the vision develops, because it's very important from 15 days to 3 months. That's when the fixation and vision develops in the brain. And if the cataract is there in only one eye, then they have very dense amblyopia. That means the vision in that eye is completely suppressed because the child prefers to use the other eye. So it's very important, especially for cataract in one eye, that the child be operated as early as possible. So we took up the child at 6 weeks for surgery, and the surgery went on very smoothly. We have removed the cataract and the child has recovered well. The child is fixating now, and then we are doing the patching and amblyopia therapy also. And with glasses the child is able to see. Parents say that the child is able to reach out to objects and able to see, even mobile or TV. And at 6 to 8 months, we are planning to put an intraocular lens. It's a secondary intraocular lens which will restore the full vision for the child.
I'm Dr. Suman Shri. I head the Department of Anesthesiology. I'm also the CEO and Director of Nethradhama Super Speciality Eye Hospital. Today is a great milestone for our surgical and anesthesia team. We have successfully anesthetized a 1.5-month baby with congenital cataract by giving a very highly skilled pediatric anesthesia by a great team of anesthesiologists and with great equipment that we have. So as you know, the challenges of a 1.5-month baby are very high. It is just 5.7 kg baby, just as small as this hand of ours. So the biggest challenge is in the pre-anesthetic evaluation, we have to ensure there are no other congenital anomalies along with the congenital cataract. And we have a documented anesthetic plan, like a plan A, B, C, that we have to have ready with us. And during the anesthesia itself, right from a smooth induction to a smooth emergence, it has to be very carefully titrated, especially the drugs, because the baby is very sensitive and also the organs are immature. So we have to titrate every drug that we inject into the baby. We have to take care of the temperature, the intravenous access, then also that we need to monitor the intraocular pressure so that the surgeon can have adequate space to perform the surgery. So apart from this, in the post-operative period, we have to ensure that there is no post-operative nausea, vomiting, and throughout the period, oxygenation has to be maintained, and also the glucose levels have to be monitored. So these are the challenges in a pediatric anesthesia procedure, and we're very happy to know that the child is doing very well today.